I always say this. I'm a plastic surgeon who works in aesthetic medicine. Why? Because I know anatomy very well. So I don't place a needle or use technologies on the face without knowing what's underneath and what might happen. The idea is that many small things can lead to excellent results. Aesthetic medicine is a powerful tool. So botulinum toxin, hyaluronic acids, restructuring, revitalization, these definitely have great effectiveness. What we are discovering, opening up faces every day, opening up faces sounds bad, but that's actually what I do in the operating room. So I go under the skin and see what has happened after years of injections. What I suggest to my patients is to achieve the most with the least. For years, perhaps we have promoted the idea of these excesses in volume. The same thing happened with lipofilling. The idea is to use the minimum amount of product of hyaluronic acid, which today is an extremely powerful and high quality tool. There are certainly various formulations available that are suitable for the jawline, for cheekbone projection, for the tear trough, a complicated area, for the temples, for the nose filler, but always in a moderate way. For example, when it comes to nose fillers, nowadays we often see, certainly bombarded by Instagram, these noses that seem instantly transformed. It can be a solution once or twice, in my opinion. By the fourth time is probably too much. Why? Because this hyaluronic acid settles, it never gets fully absorbed, and this area starts to widen so much that it almost closes off the field of vision. So we see these Greek profiles because we are filling in. It's a filler, it's meant to fill. So to mask a curve, we have to completely fill in the empty space that's there. And at first, it gives us good results. In the long run, though, maybe we need to understand that if someone truly wants a better nose, they need to consider or decide to move toward a more surgical option. So aesthetic medicine is a powerful tool, and we deal with it always following the same philosophy. The result, even if it uses fillers, must look natural. Therefore, in my opinion, plumping up lips that already have good volume is wrong. That's why lips are definitely one of the most delicate topics. There are some very famous lips from Italian television that a few years ago still caused a stir. Often people ask me, but do you know anything about those lips? Back then, as I say, I was still wet behind the ears because, let's say, many of those lips were done with silicone. My generation didn't use silicone. Liquid silicone has been banned for over 30 years, but some pirates still use it on the face. It's strictly forbidden. I firmly believe in what I say, but not because I'm some kind of evangelist. In the sense that you ask me, but have you ever refused to do something? Yes, I have to say yes. In the sense that quietly, there's a kind of trust between me and the patient who asked for something. And even without saying it outright, I try to guide her toward my own vision. So if someone asks me to inject 5 vials of hyaluronic acid, it's always a two-way street. There's the person who asks and the person who does it. I try not to do it and instead redirect her attention to other things, to a more holistic view of the face. The woman, the girl on my examination table, is not just her lips and not just her nose. That's what needs to be understood. Beauty is harmony. It's an overall harmony. So there isn't a jawline if there isn't a cheekbone projection, and there isn't a disappearing bridge if there isn't a proper nasolabial curve. There are so many little things, and that's what a true professional tries to enhance and where they try to intervene.